apologize. It's my old hat and the early morning. The coffee still has to kick in.
No problem.
And it's usually easier to see people person to person rather than through Zoom.
Sure, of course, yes.
But in autumn, I hope we can meet.
And we are waiting this time when we can see you face to face, personally.
In person, that's good. That's good. Yeah.
So I think we can start. Құрметті қонақтар, құрметті әріптестер, 27-ші халықаралық симпозиум, морфологиялық ғылымдар бойынша симпозиум өзінің жұмысын ары қарай жалғастыруда. Бүгін 3-ші күн. Жоспар бойынша бүгінде бірнеше секциялар, дәрістер жоспарланған. Оның бірі осы біздің қазір кездесіп отырған іс-шара медициналық білім беру саласы бойынша лекция, қонақи лекция және оны ары қарай жалғастырып өтетін медициналық білім беру бойынша дөңгелек стол. Осы іс-шара бойынша біздің бірнеше дегенде екі модераторымыз бар. Сол адамдарды таныстырып өтсем деймін. Ары қарай мен ағылшын тілінде айтсам, мен ойлаймын, барлығы да ағылшынша түсінеді деп. Good afternoon, good day, dear guests and dear colleagues. Our 27th International Symposium on Morphological Science is going on, and today is third day, and today we have one very important section which is about medical education issues, and we have very interesting preliminary lecture of our professor, and then we have roundtable about medical education. This topic is very important today because these difficult days, every medical education community were faced difficulties and challenges making medical teaching and searching for new ways for teaching our medical students. Let me introduce our moderators and first of all our guest lecturer, Professor Hendrik. I'm sorry for my maybe not correct pronunciation.
Just say Henk. Just say Henk. That's enough.
Jozef Frencken, Senior Educational Consultant, ICLON, Graduate School of Teaching, Leiden University. Professor Frencken is famous in Kazakhstan because of her foreign and maybe today's joint projects on education, and recently we have webinar from Professor Frencken on medical education and teaching, and I think her lecture about medical education will be very interesting. Lecture topic is professional development for teachers in the medical faculty, the use of educational models. And let me say that after the lecture, we start our round table where moderator will be Professor Frencken and Derbisalina Gulmira. She is candidate of medical science, associated professor, head of general Practice Department from Astana Medical University. I'm very glad to introduce her. Hello, Gulmira.
Thank you. Thank you, Lizat.
So we can start, I think.
Okay, thank you. Hello, dear colleagues again. I'm really delighted to be a part of such important event as this conference and roundtable to discuss the problems of medical education during such challenging pandemic times. So I'm looking forward to productive communication with our colleagues from different medical universities, and I wish all of us a productive day. So according to our plan, Henk will be present his preliminary lecture about the professional development for teachers in the medical faculty, the use of educational models. Please, Hendrik.
Okay, dear ladies and gentlemen, fortunately I see that quite a few people participate. Well, once a teacher, ever a teacher. Therefore, I would like to ask you, if you are participating, please could you switch on your video? For a presentation, it's good to see how people react. And so if you can switch on your video so that we can see you and your colleagues can also see you, I would be very grateful. Okay.
Профессор просит включить видео участникам нашего круглого стола, чтобы видеть нашу непосредственную реакцию во время его презентации. Спасибо большое, коллеги. Включите, пожалуйста, видео. Okay.
Good morning. Yes, now people are coming. Very good. Yes. Okay. As Gulmira said, I'm indeed an associate professor like Gulmira as well at Leiden University, or better, I should say I was, because I retired 3 years ago because of advanced age. And but I'm still working with the university at times, especially in Erasmus projects, and I do consultancy work on educational issues. Very briefly about myself, I did a master degree in biology, so I'm a biologist originally, and I did later a master degree in biology education. I started teaching quite some time back, actually in 1972. I was still very young at that time, but over 20. And I started teaching, and I taught for about 12 years in the Netherlands as a biology teacher, head of department, everything else. Then I worked for 3 years in Zimbabwe, in the rural areas, where I taught science. That's where I met Dr. Gilles de Wild, who will speak later today and who's on screen now. We met in Zimbabwe, and since then we are good colleagues and friends. Then I worked for 4 years in Botswana, 7 years in Mozambique, came back to the Netherlands and worked for more than 20 years at Leiden University. First as a teacher, then in teacher training, and more in teacher training in general, not only for biology and science, but also all kinds of other topics. That's a bit my background. I'm going to share my screen, if you allow me, which is this one. Share. Yes. Dear friends, can you see the screen?
Yes.
There's not much on, but
yes.
this is what you see it. Okay, good. This is what we are going to talk about pictures. So I thought it's a Saturday. Let's keep life easy. People like to see pictures. These are the pictures we are going to talk about. Or to be more serious, I'm going to talk about what function diagrams, pictures, images can have in the professional development of teachers, and why they are important. So I'm going to first to discuss why these pictures are important, how we can use them in professional development, and give some examples. Okay. So this is not a workshop, but a presentation. If you have any questions, nevertheless, if you have any questions, please interrupt and ask. Gulmira, is it necessary to translate, or can I continue? Should I speak slower, or is it okay?
I think it's not necessary. Yes,
Oh,
all participants yes can understand you.
Oh, good, good. If I speak too quickly because of Zoom, if you have a question, don't hesitate the question directly using the chat function, whatever you like. Okay?
Okay.
Right. Well, actually, this is the beginning of the slide, but I showed you this one to give you a kind of a preliminary picture that at the end of my talk, we have discussed all these things. Okay? Let's see. Let me first do this. Apologies. Trying to do something. Yes. I'm happy to see more people aboard now. Okay. First thing is, why is this? Good. First thing is the question, which competencies medical doctors should have? Well, we could discuss that. Well, when I go to my medical doctor and I ask him or her for advice, I hope he or she has the competency to find out which disease I have, how to treat me, how to talk to me, and so forth and so on. And doctors usually know what their competencies are. But there is a framework, there are frameworks, there are descriptions of these competencies of medical doctors. And a very famous one is the CanMEDS roles framework. The CAN stands for Canada, and MEDS stands for medicine, and so forth and so on. And I think it's from the Medical Association of Canada. And they have this picture, and they say that, now I have to click this one away. They tell us that there are 1, 2, 3, 4, 5, 6, 7 different roles for a medical doctor. In the middle is medical expert, and the medical expert, that's the general role, and the medical expert, each medical expert has different roles as a professional, as a communicator, as a leader, as a health advocate, and so forth and so on. It's very interesting to read publications about CanMEDS, so I would advise you to look it up on the internet because it's interesting. But scholar is one of them. So a medical doctor should be a scholar. And the definition of a scholar, of this one, in the CanMEDS roles framework is this one. I'm not going to read this text, it's not important, but what is important is this, that part of the definition of a scholar, what a scholar should be able to do is teaching others. So that's a sub-role in the whole array of roles a medical expert has. Of course, this teaching others is more important, is important for all doctors when you have apprenticeships, when you, and so forth and so on. But it's especially true, of course, for people who teach in the medical faculty. There, this by teaching others is enlarged. So to be able to teach is important for medical doctors and especially important for teachers in the medical faculty. Okay. Then I have a few steps. 1 second. Yes, here we are. Teaching is, in other words, a sub-role within the role of scholarship. Okay? Why doesn't that work? Okay, like this. Often teachers say teaching is an art, which is actually true, right? But sometimes people think, well, teaching is an art, you don't have to learn it, you know it or you can't. You can teach or you cannot teach. That's what some people think. Well, I'm sure that some teachers cannot teach. Fortunately, most teachers can, but some teachers cannot teach, that's true. But when teaching is an art, that doesn't mean that teaching is also not a profession. And a profession you can learn. So you can be a good teacher, but you can become a better teacher by learning about your trade. You can become a better doctor by learning about medicine, anatomy, morphology, whatever, but the same applies for teaching, right? Then the question is, do medical teachers have enough time? Wait a minute, now my screen is in the way. Like this, to learn to become professional teachers. In other words, do teachers have in the medical faculty enough time to be better professionals? Well, usually, especially with doctors, you know, there's never enough time. People are always very busy and so forth and so on. Okay? So, in other words, you don't have much time, you still want to be a good teacher, so efficient and effective educational professional development is needed. You have to learn to become better teachers. I'm sure you're all very good teachers. We have to learn, it's also including me, we have to learn to become better teachers by professional development, but it should be efficient, not time consuming, and it should be effective. We should learn things which we can use directly in daily practice, right? Teachers, they could do this, this on their own. They could read books, they could go to the internet, they could find all kinds of things, but again, there's never enough time. And the problem is that the information might be a bit overwhelming. When you try to find something on the internet independently about something which is not your specialization, you are overwhelmed by the information. I'm going to show that. I'm going to show that how it works. Okay. An example is Bloom's taxonomy. Medical doctors know about the word taxonomy. Some of you might have heard about Bloom's taxonomy. If you have not heard about Bloom's taxonomy, doesn't matter. After my talk, you have heard about it, but it's just as an example. The example is Bloom's taxonomy. Suppose you hear about Bloom's taxonomy somewhere in a talk like me, and you say, oh, that's interesting. I'm going to look for it. Yeah. Then you find the description of Bloom's taxonomy. And again, it's not necessary to read it. Okay, here we come. I know you should never do that on a slide, but I do it with a purpose. Because, when education is not my core business, then I'm reading the framework elaborated by Bloom and his collaborators consists of 6 major categories: knowledge, comprehension, blah, 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 and so forth and so on. And you think, so how am I going to use that tomorrow in my lesson? You can see here, it's from Vanderbilt University, which is quite a famous university in the United States. It's a very interesting link, by the way. But, you know, just reading text about Bloom's taxonomy doesn't help. Okay, then as a teacher, I think, okay, I'll take the next step. I'll go to the internet and to see if I can find any articles about Bloom's taxonomy. All right, let's go to Google Scholar and type in Bloom's taxonomy. Well, you can see, you find some things, but when you look further, you can see that there are 40,900 results. So as someone who needs direct help, how do I choose? How do I know which articles to read to understand Bloom's taxonomy and to use it in daily practice? Most of these articles, by the way, are research articles. They have research groups of students, like medical doctors, research groups of patients as well. We educationalists, we research groups of students, how they learn with Bloom's taxonomy, and so forth and so on. So as an individual, going to Google Scholar doesn't help you that much. But now we are all very clever, and when I'm overwhelmed by the internet, I always think, okay, let's go to the pictures. So I go to Google Pictures. And I find many pictures about Bloom's taxonomy. And again, I'm stranded, because now I see something which might be interesting, but I see many different pictures in Google in pictures. And still, I'm a bit overwhelmed by the information which is available. But you know, I am very happy and willing to be a better teacher. So I think, okay, let me go to a workshop. Yeah, let's go to a workshop, right? And in the workshop, what the workshop tutor does, that could be me, like 2 months ago, we did a workshop, as was mentioned by Gulmira, I think. We did a workshop on medical education for 4 Saturdays, 4 times 3 hours. And so I was the tutor of that workshop, and we didn't talk about Bloom's taxonomy, but I could have done that, okay? Then as a teacher, I start simple. I say, okay, this is the picture. This is everything which is important about Bloom's taxonomy. Now you can read, and you can see that on Bloom's taxonomy, we have different levels. Remember, understand, apply, analyze, evaluate, and create. You may understand that these levels are different levels from low to high about what people can do with knowledge. You can remember knowledge, which is, for instance, in anatomy, it's pretty important to remember the names of the muscles and the veins and so forth and so on. So it's important. It's not because it's low, it doesn't mean it's important, but it's the first step in skills. Yeah. Then you can understand knowledge, you can apply knowledge, you can analyze knowledge, you can evaluate knowledge, and you can even create knowledge as a scholar, right? If in a workshop we work with this model, with this picture of Bloom, we spend, for instance, a few hours on it. We do exercises and so forth and so on. I'll come back on that in a minute. In a workshop, the picture is explained. And just to give you an idea how it's explained, you can see that next to the picture on the right-hand side, there are now, for instance, when I look at apply, then it said applying means a student is able to use the information in new situations. So he or she can execute something, implement something, solve a problem, demonstrate, and so forth and so on. Right? So each level has its specific verbs which you can use when you describe things on this level. And as a teacher, I now have what's the English word? It's also not my first language. I would have the wish or the drive to explain you much more about Bloom's taxonomy. I'm not going to do that this time, right? But I'm just giving you an idea. So if you don't understand Bloom's taxonomy completely by my explanation now, that's obvious because I've spent 5 minutes on it and not a whole workshop. But you might have an idea. Then the situation is further possible steps I can take during the workshop. Activities I can do in the workshop is, for instance, this is Bloom again, is I can use Bloom to formulate learning objectives. I can formulate what students should be able to, should know and able to do after my course, even after my lesson, after a program. We're not going to formulate learning objectives now, but formulating good learning objectives is not an art. It's again, it's a skill you have to learn as a teacher. You have to know as a teacher. You could evaluate the difficulty level of an exam. A teacher could think, okay, I teach my students in such a way that they can analyze important medical problems. Then in a workshop you analyze an exam or a test, and you find that most questions are on the level of remembering, of rote learning. Then you can conclude that the exam doesn't test what the teacher wants to achieve with his or her students. Okay, but again, to evaluate the difficulty level of an exam, that takes you with a group of teachers about an afternoon to know how to do that. But it's very interesting. You can discuss in a workshop how to devise student exercises at the different Bloom levels. If you say students have to be able to evaluate medical problems, you have to think about what students should do in practicals, in exercises, in demonstrations, what students should do to learn to evaluate, right? You can evaluate the curriculum of a discipline, etc., etc. Okay. Up to now, are there any questions? Or is it clear? I see a few new people, like Diana. Hello, Diana. How are you? Good to see you. Is it clear, or are there any questions? Okay. As a teacher, I usually say, if there are no questions, then it's either very clear or completely rubbish, you know. And
dear professor, sorry, it's completely clear. Thank you.
Great, thank you very much. I was waiting for that reinforcement. And okay, so what we have done now is I've shown that if you want to know something about Bloom's taxonomy, you can go to the internet and wander around and be overwhelmed by the information. In a workshop, I can say, okay, let's start with the picture. And then use the picture as a starting point to elaborate on the concept of Bloom's taxonomy. And this talk is exactly about that type of pictures, is exactly about what pictures we can use, I use in my profession as a professional development tutor in medical education, in other activities as well. And I will show you a few of these pictures. I will show you a few of these pictures, not to explain you the pictures, you get a kind of an idea of the pictures, hopefully, what they are all about, but to show how such a picture can be the starting point for learning for professionals, and to learn about educational concept, to learn about them and to be able to apply them in your practical situation quite quickly. So, as I said, in an effective and efficient way, right? Okay, so I always have to learn this. This Zoom is okay. Pictures as the nucleus for concept development. Okay, there we go. Why is that so? Why can I use these pictures? A picture is worth 1,000 words. Okay? Educational concepts can be represented by pictures or images or models or frameworks or whatever name you, diagrams or whatever name you give them. Like in medicine. In medicine, you can also use diagrams to make things clear and schemes. Like, for instance, the very first slide I had was about CanMeds, the different roles of a medic. It's also a diagram which very clearly shows the different roles and labels them, you know. For you, we are still in the workshop, as an idea. For you as a workshop participant, such a picture is then the stepping stone for understanding the concept and putting it into practice. It starts with the picture. The picture gets into your mind, and gradually your concept about the educational concept is richer and richer and richer. And later in another workshop, I might ask you, okay, what is the level of this question? And then you think, oh, what is the question? And I say, okay, think about Bloom. When we have covered Bloom in a workshop, and I ask you, think about Bloom, you immediately think about the triangle. All right. So that's a stepping stone, the first step in your mind, which you can use to put on new knowledge and understanding. Okay, examples of educational concepts is, well, Bloom's taxonomy is one. There are pictures for all of them. Is TPEC, I'll come back on that in a minute. We're going to share the slides later, Enigma Tulin, so don't worry. I'm very happy if you can take any photo you like, but we are going to share the slides anyway. But thank you for your interest. TPEC, I'll come back on what it means. The language triptych, I'm going to explain that too, about constructive alignment, whatever it is. And as the last one, I will cover Healy's framework of student research. We did that in our workshop. Gulzat might remember that we used Healy's framework. And later today, Dr. De Wild is going to talk about student research using Healy's framework as a starting point of his talk. Well, these are these pictures. You saw them in the beginning. Okay, what I'm going to do now might be a bit, it's not difficult, but it's a lot. All right. What I'm going to do now is I'm going to talk about 2 minutes about each, 3 minutes sometimes, about each of these educational concepts, only having the picture with us, okay? Not that I expect that after my talk, you know everything about TPEC or the language triptych or about Healy's framework, but to give you an idea, a very vague idea what it is, and to give you the idea that in each example, I use the picture as my starting point, as your tutor in a workshop, what I could do in a workshop. And again, when we talk about Bloom, it's very easy to make a workshop of a day or a week based on Bloom. TPEC, the same applies, and so forth and so on. But I'm going to show you these pictures and then say a few words about how they might be used in a workshop and why the picture is important. But each picture, each of these 5 pictures, these 5 images, they depict, that's the best word here, they depict a certain educational concept, which can be handy for teachers. There are more. It's easy to find more, but again, when there are 5, it's more than enough. If there were 50, then you can't see the woods by the trees anymore, if that's an English expression. Okay, so we'll cover 5. Any questions? No questions, then we go on. TPEC. The term TPEC stands for Technological, Pedagogical and Content Knowledge. That sounds quite abstract, but you might recognize a few things in the picture comes in a minute. You might recognize a few words here. Content knowledge is, for instance, the knowledge about anatomy, about physiology, about virology or whatever. Pedagogical knowledge is the knowledge about teaching methods, basically, you know, in this case, you know, about how to teach young adults, how to teach in service colleagues, how to, that's the pedagogical thing. Technological knowledge is the knowledge about the tools. For instance, to be able to do this presentation, I have to know how to use PowerPoint and how to use Zoom. All right? Okay, this is the picture. And you can see the picture looks, in first instance, the picture looks quite difficult, right? But you can see that there are 3, in the middle, there are 3 colored circles. The yellow one is pedagogical knowledge. Now, let's start with the blue one, the content knowledge. The blue one is the content knowledge. The yellow one is the pedagogical knowledge. And the pink one is the technological knowledge. Why is this picture important? Because teachers can use it to prepare their lessons. And how you're going to prepare your lesson using this picture. To give an example, as a biology teacher, I have content knowledge about, let's say, asexual reproduction of plants, you know, with these runners and stuff like that. Okay? I have pedagogical knowledge about a teaching and learning methods. And suppose I'm a teacher in the beginning of secondary school, I know which methods are good with my students. So in the middle, where the yellow and the blue overlap, you have what we call the pedagogical content knowledge. In the Netherlands and not in Britain, but in some uses of the English language, it's also called didactical knowledge. You know, the didactics of biology is that I know how to teach biology. Okay? Then there is also overlap between the technological knowledge and the content knowledge. For instance, when my content is anatomy, these days there's a lot, you can use a lot of internet resources to learn anatomy. Though I was happy to see that one of my colleagues in this conference is saying, well, we can have any technological means to teach anatomy, but cutting corpses is of the essence for medical doctors. But that's not the discussion today. But intuitively I would agree. But anyway, there's also the overlap between pedagogical and technological knowledge. Anyway, how a teacher can use this model to think about the balance. Content knowledge is usually the starting point, and then a teacher has to think, okay, what methods can I use to teach this content, and what technological knowledge as a teacher, what tools can I use to make the lesson practical, you know? Then in a workshop, if we would do a professional development workshop, I would spend more time in explaining this model. I would actually not start with explaining it myself, but have you discover the model. And then we would do, I've done that quite a few times, we would do the TPAC game. I would give you in small groups a content. For instance, the content is the anatomy of the human heart. No, the function of the human heart. The technology is a few is the internet and YouTube. And the pedagogy could be secondary school. I'm not a medical teacher. Secondary school, I could ask students, okay, in small groups, find a good short video about the function of the heart, show that video to your class, and explain the background of that, the details of that video. And I could ask that to different groups, and I could tell them that if you found a video, another group is not allowed to use that video anymore. So students will do that, go to the internet, find the heart, think about it, and explain to their classmates how the heart functions. It works, you know. So in that way, I can find the right balance between the things in my education. This is just to give you an inkling, a kind of an idea about TPAC. Not to teach you about TPAC, but to tell you, okay, this is, you should, if you haven't covered TPAC before, you should now have a little bit of an idea how it's probably about that. Okay, next slide is English is a medium of instruction. An important picture is the language triptych. That's the right spelling. Is the language triptych? It's this one. It's used by subject teachers or by teachers of English in a situation where English is not the mother tongue of the students, right? And someone who works with students and the English is not the mother tongue, he or she has to have a little bit of awareness of what it means for students. This picture is used a lot. Some people have heard about it, maybe in CLIL, Content Language Integrated Learning, where English teachers, for instance, English teachers and subject teachers, secondary school, higher education, also work together to develop the knowledge of children and students. Very quickly, just for the idea. You have on top the language of learning. The language of learning is related to the subject. It's the key vocabulary, the terminology. Students need that language to be able to learn about the subject. You may provide the students with a list of keywords. You may provide the students with a text and find the keywords themselves. There are many different things, but the students need the language of the subject especially in medicine, that's obvious, to be able to learn about the topic. Students need language for learning. That's the language students need to be able to discuss amongst each other. How they can ask for help as the teacher. How they can discuss in a group. How they can write a report. That's another type of language than the language of learning. And you have to realize yourself as a teacher, those are different levels of knowing and understanding English as a medium of instruction. Now the most difficult one, it took me 3 days to understand the third one, so don't worry if you don't understand it in half a minute. That's the language through learning. That's the language that emerges and is needed by individual learners to deepen their learning. When you learn new things, you learn to conceptualize things, you learn to think about things, and you learn to use language to express your thinking. And of course, often it's done, for instance, when English is the medium of instruction and the students are Kazakh speaking or Russian speaking, people still think in Russian or Kazakh, but at some point they're going to think in English about this, about the subject, and even to the extent that the students say, yeah. A student who's fluent in Kazakh and Russian, for instance, says, yeah, I find it difficult to explain in Russian. Can I do it in English? Well, of course, you can make an exercise and say, okay, fine. When you have patience later, you have to do it in Russian or Kazakh, so please go ahead. But then the language through learning is the higher form of language development. That's the language triptych. Again, hello Gulmira. Again, we are not going to. I'm not going to explain the language, the language triptych in detail now, but just to give you an idea that if this picture is, oh, excuse me. Wait a minute, I'm going. If this picture is going to be the picture on the left-hand side, it can be the starting point of a workshop about English as a medium of instruction. Discuss with people, with teachers about, okay, which different types of languages you have. How should we put attention to these different types of languages? There's also a cultural aspect which is around, but I won't bother about that now. And so here again, the picture is the starting point of the didactical process, all right? And is the starting point for developing a concept about what you have to know as a teacher when English is the medium of instruction. And it's not your mother tongue, and it's not the student's mother tongue. Okay, next one. Constructive alignment. This one I'm going to do very quickly because time is running out, I can see. I had 40 minutes, which I have almost used up, or completely used up. The constructive alignment is very simple. When you teach a course, you have, as a teacher, intended learning outcomes. What should students know or be able to do as a result of the course? Okay, fine. To do that, you have teaching and learning activities. And what you also have is assessment. How can students demonstrate that they have acquired the desired levels of competencies? And these three things, again, a triangle, these three things, they should be in balance. You're teaching and learning, and you can exercise with teachers to say, okay, what are the outcomes, the objectives? How are you going to teach about it? How are students, more importantly, how are students going to learn about it? And how are you going to assess which assessment methods are you going to use to see whether the students have acquired the competencies, the knowledge and skills you aim for. But I told you I'm not going to because I want to go to the last one. This is the last one I'm going to cover. Again, we used it in a workshop, and it's called Healy's framework. Healy has done a lot of research about student research. And that students have to learn to become researchers is obvious. It's in the CanMaths framework, which we covered in the beginning. And these days, fortunately, all medical faculties know that students have to develop the ability to do research, one way or the other. Okay? And Healy has studied different forms of in curricula to see how students can learn about research. And before I start the picture, I show you the picture step by step. It's important to stress that according to Healy, all 4 different forms of doing student research, engaging students with research, have their value and are important. So he's not saying, okay, this is what you have to do, but he's saying he's just analyzing and saying, well, these are the possibilities. And Healy's picture, Healy's framework, after I've shown it, hopefully gives you a kind of an idea what it's about, that you can say, oh yes, of course, this is important for student research. Okay, let's start quickly. Okay. There is an axis, the horizontal axis, which there are 2 axes. The horizontal axis ranges from emphasis on on research content to emphasis on research processes and products and problems. I'm sorry. So research content, the emphasis could be on, okay, we're going to discuss an article about COVID, because I want you to know how COVID viruses work. When I have the same article and I say, okay, let's see how this COVID article, how the researchers did their work, whether it was with, then the emphasis is on the research process. It's 2 different things. All right. Then Healy said there is another axis, the vertical axis. Students frequently are an audience. They listen or maybe discuss, but they are the recipients of what the teacher does. That can be active learning, by the way. You can discuss things, or students are participants. And then Healy has 4 different types of research. The first one is what he calls research-led. It's students learn about the current research in a discipline. You say, I'm a teacher of virology, and I'm going to, today we're going to discuss about COVID and how the COVID virus enters the cell, and how it uses the spikes to trick the cell, and so forth and so on. And I have an article, very recent article, and this is the article. Let's read it together so that we know what the outcomes of the article are. That's research lab. Very good, very important. But you also have research tutored. Then you engage in research discussions. You may say, okay, about COVID, we don't know everything, and there are different opinions about COVID. Here I have 2 articles. They cover the same thing, but they have different outcomes. Let's discuss the articles. Let's see how the one article has developed the research and comes to the conclusions, and how the other article does that. And so what are the pros and cons, and what do we think? That helps not in developing medical knowledge, which research lab does, which is important, but it helps to interpret research and to as a professional, and to evaluate its value for your medical practice, for instance. Then this one is research-oriented. That's developing research skills and inquiry skills and techniques, which is very important to be able to do research. right? For instance, you might have heard that quite a few medical universities in Canada, in the Netherlands, in other countries as well, they use problem-based learning as a starting, the basis for their didactics for medical education. And at the University of Maastricht in the Netherlands, students literally on the first, wait a minute, I'm making a thinking error now. I'll come back on that. Students learn about how to do research. They learn a lot of research skills through problem-based learning. But here, research skills is also, so how do I do, how do I make a good questionnaire? How do I do a focus group discussion? How do I use statistics in, and so forth and so on? Very important. The last thing is research-based. It's undertaking research and inquiry. The students themselves. The students are participants and they learn about how to do research. And this one, some people think, many people think, unfortunately, that to be able to do this one, you have to do this one first, and this one first, and that one first, and only in the last year of study, students can do their own research. Fortunately, many people think that's not true. And Gilles and I and Divya Khanna, we are writing an article now about research education in medicine. And an example in the article is the very first year of medical studies at the Leiden University Medical Center, where students in the very first year do complete research, a complete research project, to help them get the idea about what research is. And they themselves, they find, helped by their tutors, they themselves find the topic, they themselves have the research question, they themselves have the hypotheses, they themselves think about the methods, they themselves present it to their fellow students or at a student a conference. So the idea that you can only do research at the very end of your studies is that's definitely not true. And also my personal experience is in science education that it's also very interesting to do this with the students. And my friend Gilles later this morning will talk about what they do at Birmingham University to have students do research-based education. So, summarizing what I've done, medical doctors are teachers. Medical doctors are very busy. You have to learn the trade of teaching. Educational diagrams, educational pictures can be very helpful to understand educational theories and to apply them in your knowledge, using simple articles and especially using workshops to do that. So that was the idea of my talk. That was it. Thank you. I see Gordana clapping. Thank you, Gordana. Any questions or any remarks?
Thank you, Professor, for very interesting presentation. And maybe it is not question, but also additional. When we work with the teaching materials, at English we have two definitions: estimation and the second assessment. But in Russian, it is only one definition of these words. And so it is more simpler to use English version than Russian version. because in Russian it's needs for several formulation, but in English it's more clear.
Mm-hmm. Thank you,
estimation and assessment.
Thank you, Casisa, for this it's really a useful remark, because it links very clearly to the use of different languages in education. By the way, the same applies for English. Sometimes for me it's much more difficult to express something in my mother tongue, in Dutch language, than it is in English language. But the other way is also true, and it's also complicating and making our jobs, but also enriching our jobs, because if you have terms in English for certain things, and you don't have them in Russian, when you talk to patients, you have to talk in Russian, because most of your patients won't speak English. So you have to be able to translate the concept. But your remark about the differences in languages is right on the spot. So thank you. I like that. We'll talk about it more later. Okay, any other remark or question?
So, dear Professor, thank you very much for your great lecture with visual examples and pictures, and your enthusiasm was clear so enough. So I see one question in our chat from Dania Smagulova. Good afternoon, Professor Henk. How to provide research-based lesson and cover whole objectives and aims? What methods can we use? Thank you.
It's an interesting question, Dania. Is Dania the right pronunciation?
Dania, yes.
Dania. It's an interesting question. My colleague Gilles de Wil will give you one example later in his talk on how to do that. If you would like to, but it's about the research students do in their third or fourth year. If you want to start with student research in the first year, there are very many different possibilities to do that, and I would be very happy to discuss that more in detail, or maybe we can at some point we can have an online workshop on it and exchange ideas. So Dania, so don't hesitate to contact me on the issue if you like. Okay.
May I say something?
Yes.
Do you hear me?
Yes.
I'm Professor Gordana Teofilovski-Parapit. I am from Belgrade University, the School of Medicine. Originally, I'm gross anatomy professor, what they called in the United States. And I want to congratulate to this wonderful lecture. Unfortunately, I'm older than you are. And
I'm not sure. You look very young.
Oh, thank you. Yeah, but you can make mistake by look. So let me tell you, it's so useful for young professor, for those who are career making, and just to direct them in the easiest way how to become excellent teacher. So thank you very much for all your effort. So I have only one question. What was the subject that you have been teaching before your retirement? Is that biology, botanics, I think, something like this?
Gilles, I was actually, Gilles knows that when I'm not careful, I'm talking for the next half an hour about it. But as I said, I started my career as a biology teacher, secondary school. Then I worked at the in Botswana, that was in the Netherlands and in Zimbabwe. Then I worked in Botswana at the science education department of the university there. So I taught teachers how to teach science. Then
Thank you. Don't waste your time, because I don't want to take from Professor with his time. That's enough. Thank you so much again. Yeah.
But it's an interesting question.
Time is money.
I would love to talk to you. Gordana, we'll talk later.
Yes. Okay. Thank you. Bye-bye.
Thank you.
Thank you, dear Professor. I don't see any other questions in our chat. So maybe if they are during the round table, we will try to answer them. Yes. So according to our program, please welcome Diana Lashenko from Orenburg State Medical University in Russia, with presentation of features of teaching the human anatomy discipline in students of the foreign students faculty in the language mediator, and about the experience of the human anatomy department of the Orenburg State Medical University. Please, Diana, welcome, and we see your presentation.
Give me please feedback. Do you see me and do you hear me? Yes.
Yes, we see your presentation.
Thank you very much.
You.
Okay, thank you very much. It's a great pleasure today to report about our experience in this symposium. Thank you very much for organizing committee for your invitation. And I want to start. We live in interesting time, and we work in interesting time now because due to expansion of international borders and due to development of international cooperation between different universities, now we can work not only in Russia, for example, as for me, but we can work and collaborate with different countries' professors, and including in human anatomy departments too, and in studying of human anatomy too. And today I want to tell you about our experience. We work now with Russian students, as with Kazakhstan students too, because our Orenburg city is located on the border with Kazakhstan, and we work now with Indian students from India, and I want to tell you today about our general experience in this field, and I want to stop, if I have some minutes, on our distance format of working with art students due to this last year, COVID year. Before my report, before explaining of our experience and features of working with Indian students, I want to explain you, to stop maybe 1 minute, on system of morphological departments in Russia medical universities, for your understanding why we note some features of our working with Indian students. Traditionally in Russian university, there are 4 isolate departments: normal human anatomy department, gross anatomy, histology department, pathological anatomy department, and clinical anatomy department. Sometimes 1 or 2 departments can be connected in different universities, but in such case, this department will have 2 isolate programs. In histology, for example, and pathological anatomy, but traditionally 4 departments. And for normal human anatomy, as a rule, it will be 1.5 years. Only 1 university in our country contains 1 year, this department, normally 1.5 years. And for other departments, 1 year program. And histology discipline and normal human anatomy discipline, our students study during 1st and 2nd years, and pathological anatomy, clinical anatomy are disciplines of third and fourth years. Thus, during 4 years, each student in Medical University of Russia learns different fields of morphology. And about our Indian students, Russia is not exception, and with expansion of world medical education, our country started to expand our medical education, and our medical university started to work with foreign students from different countries. And we had such experience to work with foreign students from different countries 2 decades ago, but it was another faculty due to their program. Previous foreign student faculty, firstly, students of this faculty during 1 year learn Russian language, and then they were involved into the Russian groups and learn all medicine disciplines with Russian students together in Russian language. Now, some years ago, from 2013 year, our foreign student faculty resumed its work, but on the other way, because we understand that now to learn Russian language for all students maybe is not interesting for foreign students, and our management of university gave us the task to teach our students in English language. And it was a difficult task for us, for our teachers, because we didn't prepare for such task. Maybe we speak English, but not fluently. And our experience now, 7 years experience, shows that this task was solved, and I think according to our department will solve very actively and good. And what features can be noted after these 7 years? We tried to accumulate these features in 6 main groups. First group, necessity of all teaching and methodical materials in English language. Second point, to master the necessary vocabulary and terminology according current international anatomical terminology, and Professor Frencken told about it necessity now. And the next point, the necessity of prepare text and presentation of lectures, then adaptation of foreign students. Number 5, difference in constructions of anatomy course in Russian Medical University and in different countries, European and United States. And next, technical equipment of the department. I briefly stop on each with point and explain why we decided it is a feature. Well, firstly, due to task of management of university to teach in English language, we received a very large volume of work, because it was necessary to prepare according our curricula of anatomy course in our department and in our university, to prepare different materials for practical lessons, for lectures, for final exam in our discipline. I didn't tell, but human anatomy discipline, it in the Russian university, due to 1.5 year program, includes 3 semesters, and we have module principle, 6 modules during the 3 terms, and each module is finished by final lesson, and after 1.5 years, each student must pass his large final exam of our discipline. And we had all these documents, all these materials for final lessons, for each practical lesson, for final exam in English language, only Russian version. Therefore, very quickly we translated and prepared these documents, And now it's very glad because we have all these whole materials in English language, but it was a heavy job for us. The next, for our teachers, was necessary to master the vocabulary and terminology in human anatomy according to terminology anatomica, international terminology, and it's very good. We have this edition of terminology with Latin, English terms, plus supplementary due to one of our Moscow University. We have this book with Russian version terms. And very quickly we master this vocabulary. And especially to include with picture eponyms. You know, we have many eponyms and anatomy and some eponyms which we used to tell during practical lessons, during lecture, and our doctors use these eponyms with the Russian name of Russian others and Russian anatomies too. But our Russian eponym are not necessary for maybe European countries, for United States, for India. And we needed to add some supplementary eponym in our practical lessons. Next point, lectures. Lecture is isolate part of our work, and you read lectures and you know it is difficult sometimes to prepare excellent lecture which will be which can understand our students, remember, which will be interesting. And to prepare a lecture in English language, it was difficult for us too. But I want to note that it was very interesting to prepare a lecture for Indian students because they have, according to our mind, a very interesting feature. They read from first year, they read different clinical, maybe clinical points of anatomy due to the structure of textbook of anatomy and due to the interest to clinical approach and to clinical direction of anatomy. Therefore, we prepared specific lectures for them in anatomy and try to have maybe clinical view to our anatomical subject. And we prepared now more than 30 lectures and 30 presentations as for small group of students, as for large division of student year. Very important factor, and we didn't think about this point firstly, really we didn't think, because adaptation of foreign students for our climate, for our life in Orenburg, in Russia, was very, every year, for every year students is really difficult. And we didn't think about this factor, but after first year work with Indian students, we understood it. Why? Because firstly climate. We have in Orenburg very hot and dry summer, plus 30-35 degrees, and very cold and snowing winter. And I want to show you this magic photo. It's snow. It's from my archive, and the height of this man is 1 meter and 80 centimeters, and above his head you can see 1 meter of 1 meter of snow. It's normal winter for our town, and for Indian students it's magic. And to for adaptation of their organism, they lost some months, sometimes 1 year. You can ask me how this adaptation can be as a factor in teaching of anatomy. What we noted, first model, when students only arrive into the Orenburg, is very interesting for them. But then, during second model, mass of anatomy, then splanknology module, they have decreasing of their knowledge, decreasing of their prepare level. Why? Because the adaptation is started. Another climate, another food, problem with maybe mentality, they don't understand our rhythm of life and other. But after 1 year, maybe, yes, this adaptation is finished and students started to prepare better during second year program, the third semester. I think this factor, this point is more important, and its main problem and main feature in our work and in teaching of anatomy for Indian students. Difference in the construction of anatomy training system. In Russia, we have systemic principle in our anatomy studying course, but in European countries, in many European countries, it's regional principle. And due to this difference, we needed to, in another textbook, another atlas, and we give for our students Russian atlas and Russian textbook, Russian others, and sometimes we translated specially for them different materials for maybe transferring systemic principle into the regional principle. It really main problem in our teaching of anatomy. And technical equipment of the department, it's really was feature. Now we receive a very good interactive table of anatomy. We receive, we buy some plastinator preparates, new computer for work with Indian students, and they help us during last year, during COVID year, because all Indian students leave Russia during first months of this problem, and now they are in India, we are in Russia, and I have some minutes. I want to stop last features. This feature we received last year, and I think that all countries receive this experience to teach anatomy in the remote format. And Russia, due to COVID expanding from last spring, in Russia University, we transparent, we switched on the remote format in mainly in practically in all medical university from last March. March, April, May was finish of our term, spring term. During summer, Russian students and Indian students leave Orenburg, and they were at home, and it was very difficult, I think you understand me, to learn to teach anatomy from internet and from online this platform. About our usual lessons and lecture, it's isolated subject, and I will not stop today. I want to share with you our experience in distant form of exam, because to switch on the online format of practical lessons, it wasn't difficult for us. We prepared pictures, maybe prepared supplementary orders and tasks for each practical lesson. But during December, all students, as Russian students, as Indian students, should have a final exam. How can we have this exam without natural cadaver, without natural preparates, without part of limbs, without natural organs? We didn't know, and we thought, and then we decided to give for our students multi-component exam, online exam, and maybe our experience will be useful for you. So we use two platforms which we have in our university, TrueConf platform, it's Russian platform, and YC platform for this multi-component exam. And we decided to include 3 steps in this exam for each student, one by one, during 60 minutes, during 1 hour. Computer test, then to solve task, and then to answer for anatomical figures. bank of tests and tasks, 1,000 tests, 100 tasks, and 100 figures we prepared. And I want to thank for my team, because it was heavy job for preparing all this orders, because parallel we prepare the same number of all these orders for our Russian language students. It was ICLON, and in our department we have 8 faculties, and 5 faculties from these 8 faculties pass their exam, and we prepared this large volume of tasks for each faculty isolate. For general medicine faculty, foreign students faculty, we have a pediatric faculty, children doctors, and others, stomatology and other faculties. So we prepared 16 virtual exam rooms with 16 examiners. It's an example, they sit together with a computer, and virtual exam rooms means connection of 7-8 students in each virtual room with control their face by passport, and then they can start it, each student can start his exam. First step of exam was computer test, 30 minutes we give, and 50 tests for each student. 1 or more correct answers and system of points you can see in our slide. And after this first step, this part of exam is closed, and student can continue and have second step of exam, anatomical task. We prepared a very easy anatomical task for our students. It's English version, Russian version, and some questions for each with task and system of answer. For this second step of exam, each student has 10 minutes. And then next step of exam, each student receives 2 anatomical figures from our atlases, which we use during our work. Each figure includes 15 anatomical numbers of 15 anatomical structures, and students must write by hand, not choose, write by hand name of each of these structures. And it's a view of this step of exam. And I want to share with you short results, distribution of complexity of this part of exam. What we revealed, that computer test was the most difficult part, maybe due to new set of tests we prepared specially for this December exam, maybe due to limitation of time. But it was really difficult part of exam. And a second difficult part was pictures, figures, maybe due to large number of structures, 30 structures, and due to writing, necessary to write, not to choose this structure. So it was our experience of exam. About task, we understood that it was necessary to write more concrete questions for this task, because as Russian students, as Indian students, they try to use their phone, internet source, and try to find answers in different supplementary helpers. And more concrete questions, detailed questions in the task will give for them more difficult position of this pattern. Maybe in future we will use this knowledge. And I want to summarize our experience in this teaching of anatomy. To work with foreign students in mediator language has as pluses, as minus, it's normally, and you can see minus in this slide, and really it is difficult, always it is difficult to, I think, to any department, yes, to teach anatomy not in your language, in a foreign language, even in English language. But I want to pay attention to positive points and moments. Really, for this faculty, foreign faculty, help each department to receive, firstly, collaboration with other countries and with foreign professors, maybe, to receive good language speaking experience. And we started to work with Indian students with 3 teachers in our department. Now 8 teachers in our department work with these students. 8 during 7 years, supplementary, we receive 5 teachers. So the next, it helps us to communicate with our foreign colleagues, expanding our Russian system of anatomy teaching into another countries too, improving English language, and really it gives us maybe supplementary activity. We must be in tonus, we must be active, we must control, and we must read more foreign literature, and we must receive new foreign experience from another countries, because we must have a modern level of teaching of anatomy for foreign students. Thank you very much.
Thank you, Diana, for a very interesting and relevant presentation, because as you know, all medical universities of the Republic of Kazakhstan also work with bachelor level students remotely, and with foreign students from India, Pakistan, Jordan, China, Turkey, and Central Asian countries. So, and we have the same problems in such learning, and we can solve common problems together. And can I ask you, so as a clinician, of course, we also have a lot of challenging problems during the pandemic time, but also have some privileges, because the world healthcare community receive as a free access to the evidence-based electronic databases such as UpToDate or Cochrane Library or International Guidelines Network. So do you have such support from Anatomy World Society?
Yes, we have such support too, and COVID pandemic, yes, was very suddenly for us, and some first months maybe we only think what can we do, but then we receive support from our electronic library, because according to Russian laws, each medical university now must have electronic environment for education, and this electronic environment every university every year adds new different platform, maybe resource and others. We have this support and tool, especially for clinical departments, especially, but for morphological departments, if we can't show natural organ, and students can't rotate this organ, palpate, yes, touch, maybe look and remember, yes, it's nothing. You know, to teach anatomy by pictures, from pictures, it's nothing. Clinical departments use many international guidelines from different, from therapeutics, for example, guidelines. They use really too. We use some international resource for anatomy. We recommend it for our students, but natural cadaver is natural cadaver.
Yeah. Okay. Yes.
Even with table, interactive table of anatomy, yes, very good. It's a language of students now, because it's like a big computer, and but it's not real anatomy, not.
Yeah, yeah, I see.
I think you
So, yes,
understand. Yes.
thank you for your presentation. And as our dear Professor Hank said before, according to the language triptych, the language of learning is important. So also this is a very relevant issue, saying about how we should to teach our foreign students. Thank you very much, Diana.
Thank you.
And
Thank you.
yes, and one question in our chat. Hello, Miss Diana. This is Mohan, second proof student from Al-Farabi Kazakh National University. Firstly, I feel it's my honor to hear your presentation, as I am an international student from India. As an Indian, the teaching patterns here is very different. How should an Indian should cope up with Russian or Kazakh universities? Thank you. It's not a question, but some additional, yes. Okay.
Okay, thank you very much.
Thank you. And dear Professor Hank, could you say some remarks?
Right.
Yeah?
Yes, of course. The question is very interesting, because Diana rightfully has said that students have to adapt to the Orenburg, let's say, the climate, the culture, the everything. I was a few times in Oktober, which is not very far from Oktober, from so I can understand how it looks in and very beautiful, by the way. But it's of course the way of living, but it's also the teaching system, which is quite important. And I've been working in quite a few countries with students and staff, and you find different educational cultures all over the place, and especially young students, they have to adapt to it. And I'll give you one example. I'll just give you one example. I was at a university in Kazakhstan in a medical faculty, and I was going to observe a lesson. I was asked to observe a lesson. It was a teacher who had just arrived from India. And later I spoke to the teacher, and just before the lesson, he was really a nice guy, open, a good person. And it was his first day at the university, and he had to teach anatomy. And he said, I'm starting at, that was his first word, we are on page 53, and this is the diagram. And he started to explain the diagram. Later, after the lesson, I unfortunately, we hadn't time to discuss the lesson in detail, but I was thinking, so I would introduce myself as a teacher and tell the students I'm from there, this is my experience, and so forth and so on. And this was not a bad teacher, this was a very good teacher, but apparently it's not in the educational culture, at least where he came from, to think about that you have to build personal relationship with your students too. So he is definitely not to blame for that. That's not my point. But I saw students in looking at the teacher like this, and why does he start? Who's this guy? You know, and so there are very important differences in the educational culture, how you have to deal with your teachers as students, which type of questions you can ask. Can you interrupt the teacher when you want to ask a question? Are jokes permitted in the lesson? can I, and so forth and so on. There are huge differences. And people have to adapt from both sides. So one way out is, but I'm sure Diana has to say more about that and her own experiences. But one idea would be to have your foreign students together after, let's say, a week and with the teachers, and just to discuss the issues. Okay, so what's happening? What do you think? And how do you like it? But Diana, you have much more experience with foreign students in your university than I have, so maybe you can say something about it.
Professor Henk, we first year for us of this work really was very difficult because we didn't understand. Yes, we had not this experience of another culture, educational culture of Indian students, for example. Because we work many years with Russian students, and we didn't wait another culture really. But after some months, after some first year, we discussed each other with our teachers. What problem? We didn't wait with adaptation. We didn't wait their culture, because our Russian students after 11th form, after school, they know how they can sit every day, every night, and learn. For Indian students, it's not so. After their school program, it was necessary to learn them how they must to prepare to teach in medical university, because they have another educational culture, really another. And this difference for them and for us was very difficult. But then we asked them, what problem? Why you didn't prepare? Why they didn't want to work with natural preparates first year? Really, it's cadaver. Let's use it. Use. But not they. No, I will not work. It is necessary. But maybe after 2-3 years, these problems will finished. I think because more older years told for students of first year, please, you must learn anatomy. It's strictly department. You must work with cadavers and others. Now we practically have no such problem, but sometimes it is necessary to stop lesson and to stop lecture and explain how with Indian students and other students must prepare, must learn, must study. We teach to anatomy, and we teach to teach, and we teach to sit and prepare. Another culture, another mentality.
Sure. I can give you very briefly an example of what we did at Leiden University about 10, well, it's more than 10 years ago. It's maybe 15 years ago. There was a huge influx started at that time of students from China. And what we experienced in Leiden was we got remarks and even complaints from teachers about they didn't know how to deal with students from China, and so we decided to have a seminar on that, and there was a countrywide seminar. Holland is a small country, so it was easy. About 200 teachers from all kinds of universities, and for a day we discussed about the Chinese educational system, about how students behave, why they behave like that. Well, and of course, every student is different. And you can't say the Chinese students or the Indian students or the Dutch students, but there are some features which are, let's say, comparable. And we discussed why things were happening, why they were happening. We did that together with the Chinese department of the university and with people who had experience in teaching in China. I see Mr. Yang being there, and I've been in China many times, and also at universities, and I like it very much. But it's different. It's quite different from the system in the Netherlands. Mr. Yang, can I ask from which university you are?
I'm from Leiden University, Guangzhou, located in Guangzhou, north part of
Guangzhou.
In Guangzhou. Okay. All right. Yeah. It's near Hong Kong. Oh, it's not Jinan in Shandong.
No,
it's not.
I know. Most of people thinking.
Okay, welcome.
Thank you very much.
But anyway, so to have, as Diana also says, to have discussions with teachers and workshop with teachers about different educational systems helps teachers to be better teachers for their students. And as a last remark, I would like to compliment Mohan. It's a very good question you ask.
Yes.
Yeah.
So Mohan,
yes,
thank you.
This is a huge issue about the diversity and about the student-centered education and teaching in our universities. I think this is a topic of separate roundtable maybe, because a huge task. So yes, welcome Yang Jinan. Sorry for my pronunciation, from University Medical College of China, and with presentations anatomy education online in China during the COVID-19 pandemic. Please, welcome.
Okay, thank you.
Yeah. And also, dear Henk, a very interesting example about the teaching anatomy in Aktibe Medical University, when nice, lovely ideas, inviting the Indian professor to teach the Indian students. Yeah, so, okay.
Right, can you see that?
Yes, we see your presentation.
Okay, that's great. Okay, right. Have to ask somebody to give me a hand. Otherwise, I'm not really good at deal with that. Thank you very much for your invitation. And really great to have a chance to share what we done in China. And right, so. What I want to introduce about anatomy education online, during the COVID-19 like this, right? So my name is Yang Xuesong. I'm from Leiden University, like I just said, near the Hong Kong, not in the Shandong province. Right, so let's start from here. We completely isolated in the half years, last year, something like this. So we're just thinking, it's better to give a survey for about what's going on in all the China. I mean, anatomy education, and before the COVID-19, I guess not so many people, or like this. No, we cannot say no people, but most of people don't like online teaching at all. But we don't have any choice when the COVID-19 comes, so we just do the half years in online teaching in all the China and in all the world as well. So just thinking, give a survey during that time. And basically, I will say, I don't know whether or not you know that in China, the mainland of China, generally, there are 100 major medical schools. Of course, they are extended a lot recently, for some of them might be professional training, but generally 100 medical schools in China. So we get the response from might be more than half, 60 or 77 or 78, roughly, that covered every province. So I would say that can represent the situation in China. So that is what I'm trying to talk about. Right, so generally, we want to talk about anatomy education, including the gross anatomy education and histology, embryology, which I'm doing, right, in China, online teaching, and another one is the anatomy education for the different major of the medical student. I will introduce later on. Okay, let's start from the gross anatomy education online in China during that period, the half years. And so how about that? So basically that response from the 77 medical schools. So you see more than half, so half the school cover all the major university in China. So that situation, how about that? And what we can see, the result definitely show us from the, for example, how about the anatomy online course before the COVID-19. You know, if you have that experience, your surgery might be get better. That is the idea behind that. So we can see most of the, for the serious lecture, might be cultural percent, they have some experience before the COVID-19. But for the practice, I mean the anatomy practice, more than half. So they don't have any experience. Probably two of the reasons, like I said, they don't like that at all. Or even they have kind of jump, but they don't do that before the pandemic, before the COVID-19 come. And what kind of the format they used, for example, when they come, roughly most of the medical school prefer to use synchronic living broadcasting. I'm not quite sure whether or not that will be similar to yours, but 27% of medical school use, you know, the mix of them, and even 36% of the medical schools just simply suspended. They don't do that anymore because they just think no work. They want to do that after you know the COVID-19 gone. Nobody knows it lasts so long time, so they have to pick up again. For the hours, the lecture hours, for the series, you see nearly the half, they don't change too much. For example, 100 academic hours for anatomy, so they still use the same time for teaching the anatomy, gross anatomy. But for the practical, the practice, they quite less than that. So how about the teacher and the student interaction? You know, that is very important. Just now you talk about a lot, right? So nearly half of them use less than normal hours and more, you know, for the practice. So you can see that compare the serious section, the lecture, the practice might be the more problem, right? So the correlation, the coincidence, they say, oh, right, the question there is no problem. Okay, so let's move to the body donation, online learning effective. So what happened now? For the body donation, you can see that most of the medical school, they received less number of the body donation, or even they have some of the, some of them, they just completely stop the donation program at all. So for the learning outcome, so you see nearly half, they thinking they just get 60% or 80% learning outcome they can arrive during that process. And might be roughly 30% they thinking the better might be the 80% or 70% learning outcome have been achieved, roughly like this, okay? For the active learning and on-site assessment, what they use, and most of the medical schools, say 35% of medical school, they use a group discussion and floppy classroom. It's quite popular in China in the floppy classroom, even before the COVID-19 come. So that probably help a lot. So the floppy classroom use a lot. For online assessment, most of them, they simply use the recording attendance and just online test. It's still in struggle, to be honest. So what we learned from the, you can call that benefit or the difficulty point during the gross anatomy education online, we can see for the good point, they're thinking, oh, okay, they can learn something. They can develop the new teaching method, no matter that is the push. I mean, even though they don't like, they have to do that. They don't have any choice in that situation. And even, you have to use, you cannot simply use some teaching material like you use the traditional classroom. And for the difficult point, it's quite similar. The people always say, oh, it's not easy to get enough, teaching environment for carry on online teaching, right? Platform is not really good enough, or even the internet sometimes, the students say, oh, internet is too slow or broken or sometimes, right? So more difficult point is it's not easy to get what situation for the student progress. So whether or not the student learn, it's quite simple. For example, when you go to the classroom school, you can ask the student directly whether or not you understand or whether or not you know, but you cannot do that online so easily. So that is the difficulty point. Right, besides that, they also supplied a lot of the suggestions. It's quite good. I'm sorry I don't have enough time to introduce, but the generally including demand in the learning technique, what is really good for in the future, and how about the evaluation for the online teaching in the future. They have some good example. And for the something very useful, and could be that they have quite good, the suggestion they gave us. So that summary, what we done in the first part, generally they have successful, experience, but also it's quite big challenge as well in the gross anatomy education. And just because that, many of the medical schools in China, they have experience, they can do better. But if they don't really have experience especially for the practice, they just simply suspend it. They just stop. They want to do that after they're over. So you see, what I'm trying to say, they have a good experience, but they have some difficulty point, and they just simply learn a lot, and they thinking might be better, right? So next part, I want to introduce generally situation in the histology, embryology online teaching. Generally, I would say much better than the gross anatomy, because I am myself working in the histology, embryology education as well. So I will tell you the reason. And it's similar. We got 78 medical school response from roughly 100. So it covered most of them in China. During we asked them about the perception of the histology, embryology teaching. That. And again, that we don't want to go ahead for that. So how about let's start from the active learning. It's quite important. And active learning, and when we ask them whether or not they stop, you see nearly half of them suspended, and for that reason. And active learning before the COVID-19, some of the school, quite a lot to be honest, 36% of the medical school, they have done that. So they just simply continue to do that when the COVID-19 comes. And for the assessment, for the learning assessment, some of the school, 20%, roughly 20%, never done that before. So they have to do a little bit. So they have to go down them, but more than half, you see, done previously, so they can easily do that. So that is a good thing, to be honest. Learning outcome. So how about the feedback for the learning outcome? For the learning outcome, you see the yellow one is, I will say half of them say fine, we got maybe 80%, more than 80% learning outcome have achieved. To be honest, that will be much better than we expected. Even much better than the same time we do the gross anatomy service. So what are we talking about? The histology and embryology for the online teaching in general, I mean, the perception for us is much better, especially for the practice, much better than the gross anatomy education than that. So I'm not surprised. Quite a lot of the medical school, they are satisfied, nearly half, you see, very satisfied and satisfied the result for the online teachings. And for unsatisfied percent, they just because they're similar to the gross anatomy. So you see, they complain that they don't have enough teaching environment, the platform not good enough, difficulty to get the situation from student progress as well. So that is. Like Professor Frencken asked me, the difference, it's quite different. In China is a big city and a big country. So it's different, the localization is much different. And you ask them to satisfy medical school, a lot of them is located in the, we call that first tier city, the Beijing, Shanghai, like the Guangzhou, the Guangzhou as well. So it's a really big city as well. So they have a lot of the relatively good equipment for carry on the online teaching. Probably that is one of the reasons. Okay, so that summary, what we found in the histology, embryology education. Generally, I just thinking much better than gross anatomy. One of the reasons I thinking based on the data from our from our service is before the COVID-19, compared the gross anatomy, especially practice, the online teaching have been carried on a lot. Or probably you don't call that online teaching. For example, in our department, we don't have any kind of the microscope at all. I'm not proud of that. We really like that, but problem is, if I have time, I can tell you most of the things. We don't have even technician at all. So we have been pushed to move to the online at all. Before the COVID-19, we scanned every slide and then moved to the computer and used that in the laboratory already. So you see, when the COVID-19 come, we just simply move that into the internet, right? So most of the same situation happened in every medical school in China. So that is what I'm thinking. Much better feedback from the histology and embryology education online. Compared better than the gross anatomy. They just thinking they have to touch the body, otherwise student cannot know anything. Well, anyway, that is the thing. Another thing is similar, so I don't want to repeat anymore. The last thing I want to repeat is, in China, for the medical student, we generally have, of course, most of them, majority of them is clinical medicine, but it is still teach the other major of the medical student, including the public health, the dental school student, or traditional Chinese medicine student. They still have a lot. So it's just thinking, before the COVID-19, we use the different teaching hours, a little bit different system to teach them anatomy education. So when the COVID-19 come, is there a difference? That is our questions. So we just carry on the similar result. We got the 66, the medical school response, and they just tell us how about the perception of anatomy teachers from the different teaching the different majors of the medical student. We simply divide them into two groups. One is clinical medicine, another is non-clinical medicine, including all of them. Okay, so that is the result. That is the result. Before the COVID-19, the active learning, most of them, no different between the group. I will say that most of the result I will show you now from here is quite similar, between the non-clinical medicine majors and clinical medicine majors. They just simply use, something like this. Okay, and before the COVID-19, for the serious sections, we use some of the format. It's just a MOOC, and the other floppy classroom is also a little bit different, but not much, not significant different at all. Right. So if you look at the before the COVID-19, how to connect, the practice, the students, the answer is also similar. They don't have experience. They don't like to do that. Most of teachers say, well, I don't want to do that because otherwise the student cannot get what they need, right? So that is the general situation. When the COVID-19 comes, so online assessment, most of people, the medical school, they are similar, but they use, they have to move on the online, but response is quite similar. Some of them, they stop. Some of them, they move on to them. Talking about almost the same as they are doing in the classroom. Okay, so that is the situation. For the serial sections, there's no difference at all. Most of medical school use the synchronic live broadcasting. You see, some of them use a mix, but between them, there's not much different at all. And how about the practice? Although they are suffer a lot, but you can see nearly half the cancer for the both of them. They not only the cancer, the non-clinical medicine, but also them. They simply they don't like to do that. This is cancer to them. And for the what kind of platform they use, they also, if they do that, they use the synchronic live broadcasting, and teaching management that is established by the university, or even use some of the social media as well, like WeChat. I don't know whether or not it's quite popular in China, and they're using that. And for the kind of how to connect with the student, they always try to struggle to know how about the student, the learning outcome. So you use some of the real-time voice communication, or some QQ, or email, or even call them, or use a test, most of them. So that is the major point. The active learning or online assessment a little bit different. I would say most of the people, based on the data we got, I just thinking for the clinical medicine, the major of students, the response for teaching them is better. Another difference is they just thinking compare the non-clinical medicine. The teaching the clinical medicine major of student, it will be better. So for all the survey, I just get two. I assume that they have a significant difference for that. All right. So the summary what I talk, and based on what we done the survey in the different majors and recording the serial test, serial or the practical active learning or assessment, most of them roughly similar, but just the two item is a little bit different. Okay. Right, so I need to thank our collaborator, Professor Chen Xin, Lucky, Wei, Li Yunqing, and he is the leaders of our Chinese Anatomy Association. You probably know that. Yan Yu as well. Right, I will stop here. Thank you very much. I'm really glad to meet you. I'm really happy to answer your questions if you have any. Okay, thank you very much.
Thank you, Professor. And I don't see any questions in our chat. And thanks to our professor for such an up-to-date presentation. And we were also able to see a presentation based on analysis of articles published in the peer review journals Dear Henk, is it the part of the Healy research-based framework?
Mm-hmm.
Yeah.
Well, firstly, I would like to thank Professor Young for his very good presentation. Jen Hao, very good. And there was such a lot of information in the presentation that I'm looking forward to see the slides again.
Sorry,
and to study them. Thank you, to study them thoroughly. And of course, there is a relationship with Healy, but this presentation was about the shift which took place from the educational point of view in the 3 subjects when it comes to how the subject was taught and how it was perceived by people in the universities, what the effects of that change were. And that's very important and very interesting to see. And it tastes for more. And like it was said before, even this topic could cater for a whole conference rather than just an unfortunately short talk of Professor Young. We have to say much more than we, but it's.
Me too. I hope we can contact each other in the future. Definitely.
Yes, we'll keep in touch. Certainly. Thank you. Thank you very much. Very interesting.
Yes, and I would like to draw your attention to very useful resources which our professor said about during online learning about the MOOC, massive open online courses and live broadcasting. I think it's very useful resources for online education. Yeah. Thank you. And could you take off your presentation on our common screen, Professor? And our next speaker is from University of Birmingham, UK, Divya Hanna Gills-de-White. Sorry for my pronunciation. With a very interesting topic, teach, learn, and do research in the undergraduate medical curriculum, students and an academic's perspective in the light of Healy's model. Please welcome.
Gilles, you have to switch on your microphone.
Yeah, sorry.
Now we can hear you.
Yeah. Yeah, you can hear me now. So I'm just trying to share my screen with the first presentation. That is by my student, actually, who unfortunately could not attend an unavoidable commitment. So I am not the Albert Einstein of information technology. So bear with me while I try to share this. Let's see, it's not this one. Yeah, do you see anything shared or not?
Not yet.
Do you see anything on your screen?
Yes, we see maybe last slide. Any
good.
question? Yeah.
Excellent. So then I will start now. And this is from Divya.
Perfect.
And we what I do on purpose. Yeah, can you hear me?
Yes.
Oh,
Perfect.
very good. So, yeah, so good. I will present the student experience first, and then mine, and then all of it, I hope, in 12 minutes. So Divya Khanna has completed the course called Bachelor of Medical Science in Global Health. It's an intercalated year that is an extra year after year 3 or year 4 that students do. And this is the place where it is situated in the 5 years of core medical training for students. So it's in the middle, really. And this is Healy's kind of model. And I think what Divya does fits in all boxes, but particularly in the right upper boxes, because it's for a large part a research-based degree study with a piece of research that is assessed and so forth. What she did is she went to Brazil. This was before, just before COVID. She had to be sort of evacuated in February or March last year before the doors would close and the flights were cancelled when the COVID broke out. Really looking at what patients and carers thought of their failure to complete treatment in leprosy. Leprosy is a huge problem in Brazil, much more than you would expect from a middle-income country. It's quite an outlier in that sense. So that's the situation there. In literature showed that there was quite a few things, but not really an in-depth exploration of what the patients and the carers thought themselves. And that was also a request, as it were, a wish by the host organization to have that explored with the qualitative approach. So that's what he did. If you see that leprosy on the hand, it can cause terrible misfigurations and scars if it's not treated early and well. Okay, so she did 27 interviews and used a qualitative approach to do that with all sorts of details, kind of make sure that you could upheld privacy and anonymity. And this was her poster. I'm not going to show it for very long, but I guess it will be available for yourselves after this conference. And we thought it was all very useful. It helped the host setting in this state in Pernambuco to think, oh, we didn't really thought of this kind of barriers that the patients and the carers thought for completing their course and getting into trouble, and informing them how to do better with the healthcare responses. Here we have DVR. Of course, they all also on the right-hand side. They also go on a little holiday afterwards, and it was a very good experience, as she tells, dealing with the unexpected because it's far away, language barriers. But yeah, they basically lead the research, and that's quite something for a medical student who has done 3 or 4 years of study. Challenges. I think she was robbed, and there was no violence, but she lost her phone, and so she had to go to the police and all that to have that reported, which is a problem because you need your phone for your research. Working with a new team, negotiating, and learn a lot of professional skills, but also life skills. Why does Divya think it's important? Basically, yeah, it could be good for your career. And of course, you can contribute, if you wish, to the academic community. And I think that's what she did with her study, helping the leprosy control program in Brazil to become better. And you start to think more laterally. I will come back to it in my own presentation that is immediately after this one, and of course it's fantastic for professional development. So now I'm going straight on to the part that I was to do. Sorry again. Can you see this? Just need some...
Yes, yes, I see.
Brilliant. And I'll start with this one. Praise for the start. Yeah, so that is myself. I'm a what we call a GP, a primary care doctor in Britain, in England, and I used to work in Southern Africa for quite a few years. That's how I know Henk. And interestingly, I added that quickly, with doctors from many countries. And I must say that was such an interesting and inspiring experience. Many from Western Europe, Soviet Union, can't remember Kazakhstan, but certainly Russia and Poland. The Americas, North and South, many from India and Pakistan. And it taught me a lot about the differences, the medical cultures, but also, I must say that the universality, the commonality that we all have as doctors, it is, whatever you think, a brother and sisterhood that has a universal value also for patients. So we should also, I think, honor the commonalities, not just the differences. How did this program start? It was really luck or a fortunate series of events. There were just a few enthusiastic academics in Birmingham who just wanted to do this this intercalated year, including global networkers. My then boss was the archetypical networker. She was excellent. She was not a medic, but I think I've got a lot of networks as well. So what they do is they really get an introduction to global health, and it can only be an introduction, but global health is the whole world. So they get tools, if you wish, to explore global health in depth with a academic approach. And to confidently present findings and viewpoints in spoken word and doing research. And I think very important, as anywhere, and certainly it's a natural thing anyway in primary care, acting on the basis of limited information, which is very topical now. I cannot repeat often enough to the students until they get tired of it, the validity of Jon Snow. That is 1.5 centuries ago, how he managed quite effectively to control the cholera on the basis of very limited information. And by definition, obviously, the COVID-19 epidemic is such a situation where we continue to work with limited information, but we need to act in the terms of public health and individual clinical medicine. Very important, I think, is the experiential learning. The students do a lot of homework in small groups, and they prepare and deliver presentations and debates, role plays as well, and thought experiments. And the idea is that they develop and own their learning rather than receiving it. It is very much outside the box, and it is a break for most students with previous, sometimes quite spoon-feeding teaching, and in the secondary school and in their first 3 or 4 years of medical education. And I can't stress enough how much I'm struck by the fact that the international baccalaureate students, I think of which you have quite a few in IB schools in Kazakhstan, they feel immediately at ease with this kind of approach, because they are taught in their secondary school to think widely, society and science and all that. And it's really very much about unlocking their potential. And as I said, I think we are in all 4 corners of the Healy model, but particularly the right upper corner. This is the timeline for every year group. Between September and January, it's a lot of teaching, experiential learning, exams, and different issues, disease control, socioeconomic determinants of health are very important. We do brief forays into social sciences, in the beginning of the course, not in the second half of the first trimester. And that is because in the beginning they're really keen and they want to learn everything. And after a month or 2, they think, oh, this is all rather too much. And why is Dr. De Wild bringing all sorts of philosophers in? in the beginning you can still do that. And it's to make them familiar with the concepts, which are so important for global health or national health. Issues on trust in healthcare, Amartya Singh on development, Putnam on social capital. Actually, there's quite a bit on social capital and ex-Soviet states, and also to get an idea of the language that social sciences speak. And we as doctors, we sometimes think, well, what are they getting at, and how does this help us to make my patient better? But it's the introduction, opening up, that they might see the value of that. Then the study, hopefully a field study, or it can be secondary data analysis or systematic review, is mostly meeting a research needs. Interestingly, I think that's in your area, really. We had 4 students last year. Again, they had to be evacuated from Mongolia when COVID broke out. They did fantastic stuff on indoor and outdoor air pollution in Ulaanbaatar, particularly in winter. I think you're very familiar with that. If I'm not mistaken, it's one of the worst places to live in winter for that reason. Quantitative and qualitative. This got a little grant to carry on, to deepen it by UNICEF, so it's not published yet. So what did the students do? In April, they present a poster, and it's assessed, and then they complete the dissertation, and it's always in the format of a named peer-reviewed academic journal. So if it's good, or if they can make it good after their Marcus comments, they're almost already there to actually submit. The posters are often presented at conferences, and after June, most of them submit. Not all are successful, of course, and some they lose heart after 3 or 4 rejections. And the publication period is something like 7 months after June. That is Divya Khanna, who's a bit of a star pupil, to even 3 years later, or sometimes not at all. These are a few examples of the things we did recently. Ayan Mohammed did something in Kenya about FGM. Again, she had to be evacuated in March before things were closing in. Quite a few things in Peru, in Iquitos, the northeastern part of Peru, which is quite poor. And they have had a list of regional health research priorities, which we were helping them to fulfill together with the host academics. Let's see, there's a few more. I will not spend too much time on it, but it's mainly qualitative, actually. And that is not because we have a preference for qualitative, but what the hosts say, well, we know the figures, we know about the figures, we've got the stats, but we want to know what is behind this behavior of patients or these perceptions of doctors that makes it more difficult to deliver effective healthcare. Of course, we had a different year, 2020 to 21, and all research had to be done by video calling. And that was a bit of a change for everyone it is, but it sort of worked out quite well. They have submitted their dissertations 2 days ago, and it was not always a request from a host setting, but certainly things that we felt were useful. And we thought what we also want to do is capture. Like a colleague from Guangzhou said, capture what was done during the epidemic, and see what good we should retain, and how it kind of improved our ability to deliver good research and teach. So this is the kind of groups that we had interviews with. Again, all qualitative, and we hope that the majority of those will be published soon. We do like to think that we are a little bit of a laboratory for wider things. As you may be aware, certainly in Western Europe and Americas, there is the Black Lives Matter situation. They have kind of triggered a lot of discussion. about colonialism and all that. And so what we did in November last year is have a student-led afternoon to explore these things from different perspectives, including from diaspora perspectives. And of course, about half of my students, or even more, they are from diasporas. They have African ancestors, or Indian, or Pakistani, and so forth. And that was very, very, very good. And it feeds back at the moment into reviewing the standard core curriculum. And also we have all sorts of seminars about paradoxes and controversies. Let's see. And I thought, I was thinking, if in my former slide, we have quite a few lectures on the ex-Soviet bloc that includes Eastern Europe. Also, it's our neighbors. If you think European Union, of course, Britain isn't that. It's our neighbors. You're our neighbors. Very, very little. It's completely under-taught. And while it is very interesting, because there's so many similarities, if you wish, particularly with the European Union and the Soviet, ex-Soviet states, because there's all these migrations from one part of the original Russia to other things. So demographically, there are very interesting similarities, and they may all have an effect on health and healthcare and how to improve it. Weakness, we don't really have a good system yet to obtain feedback from students. You know, later on in their medical career, we would like to know how they feel. It formed their professionalism. I mean, it's a bit of a naughty remark. I don't like doing feedback in November or December, because they all say, Dr. De Wilde, it's far too much work. No. So, but when you do it at the end of the course, you say, yes, it was really good. So we still have to find a way to do that. And I think Divya was suggesting do something more with Facebook. And again, I'm not the Albert Einstein of IT, so I will rely on her help. And that's all from Birmingham, really. So questions, please.
Gilles, maybe I can make a remark. It's a pity that Divya, as a student, is not here, because during the workshop we had with Al-Farabi University 2 months ago, where you also presented, Divya presented herself, and your presentation is very good. Divya's was even better, you know. And
no.
And unfortunately, she couldn't attend this session. Actually, Divya, Gilles, and I, we are currently working on an article, hopefully to be published in the Al-Farabi Medical Journal, about student research. And Divya has just started to interview students from the last 10 years of Gilles' program about what, after a couple of years, they perceive how they perceive the importance of this intercalated year for their professional development and also for their personal development. And one of the things which is important is that courses for students can be utterly boring, and they don't learn much of utterly boring courses. But some courses can be life-changing. And this is a type of a course, I'm sure, that students will report, this was life-changing. It changed my life, to go to another country, do research, being acknowledged to be published, and so forth and so on. So thank you, Gilles.
Yes, thank you very much. And this is another great experience of research-based learning on such a long journey, yes, from choosing a topic to publishing in the peer-review academic journals. So thank you very much for sharing your great experience. Okay. So we have the speaker from West Kazakhstan Medical University from Aktyube, Jamalieva Lizat. She is PhD and an associated professor, head of the Center of Family Medicine and Primary Care Research, with topic organizing scientific research among family medicine residents. Please welcome Lizat.
Can you, sorry. Dear, good afternoon, dear participants of the Congress. And Gulmira, could you please give me an opportunity to switch my...
Okay, so our... Yes. Yes, please.
Gilles, you have to switch off screen sharing, please.
Your your presentation.
Sorry, am I the troublesome one? Let me just see.
Yeah.
Okay.
There we go. Let's see. No. Oh yeah, stop share. Is that better?
Thank you. Yes,
yeah.
yes.
Sorry. Yeah.
Lizat?
Good afternoon, dear participants, and let me introduce my presentation about organizing scientific research among family medicine residents. Even though the importance of research in family medicine has been acknowledged, primary care research is far from achieving its true potential, as the number of publications is relatively small comparing with publications in other medical specialties and disciplines. Research skills are not required for national board certification, as I know in other specialties also. And there are no credits for developing research skills in our basic typical residency program. So according to the Postgraduate Medical Education WFME Global Standards and WONCA Global Standards for Postgraduate Family Medicine Education, capability to be a scholar contributing the development and research in the chosen field of medicine is one of requiring training outcomes. Both documents say the trainee must achieve knowledge of the scientific basis and methods of family medicine and become familiar with evidence-based medicine and critical clinical decision-making specific for the care of family medicine patients. In the training process, the trainee should have formal teaching about information management skills, including critical appraisal of literature, quality improvement, scientific data, and evidence-based medicine. And students should be exposed to research. There must be policy that fosters the application of research into practice in training settings, and teachers should provide available opportunities for combining clinical training and research. Trainees should be encouraged to engage in health quality development and research, including qualitative research. As I already mentioned, there is no discipline in our typical residency program developed by Ministry of Health, and so last year we developed elective course evidence-based medicine and assessment of national clinical protocols for residents, and completion of a research project was obligatory for all residents during the second year of program. We used the inverted flipped classroom method by providing of online educational material for independent study. After that, we demonstrate residents of an example of research project using a real clinical case from their practice. And they should use algorithm of 5 steps of evidence-based medicine. Then we assigned one mentor for small research group for each group. After the residents have several weeks to perform their research project, and after preparing, they have opportunity to present their work, and all participants, first of all residents gave feedback to each other and teachers as well. Here you can see the our residents research project, which they presented on our conference last week. Now, you can see, for example, such a project as critical evaluation of clinical protocols for the treatment and prevention of urinary tract infections, and difficulties in monitoring neonatal jaundice in the practice of a family doctor. Next, fibroids and pregnancy, or is a screening ultrasound in the third trimester necessary for physiological pregnancy, and so on. So very little research, only 9, was actually conducted by our residents. What lessons have we learned? We have great difficulties, our residents have great difficulties in formulating research questions and critical appraisal of publications. Also, unfortunately, we have few skilled mentors required for close guidance. And 4 credits of an elective course are not enough, even for the 5 steps of EBM. Factors hinder research among family medicine residents are lack of interest, a negative attitude toward research, lack of time, lack of skills of search of information and critical appraisal of information, of reading in English. Factors that encourage research during residency are the presence of a good skilled scientific mentor among their family medicine teachers, and the opportunity to make a presentation at the conference and have a certificate in case of a possible scientific career in the future. Conclusion, despite the weak results, we hope that the introduced elective discipline increases the involvement of residents in the acquisition of research skills and may motivate them to conduct own research in primary healthcare. Thank you. If you have any questions, I will be glad to answer.
Thank you, Lizette. Thank you, Lizette. So maybe we should say that our senior students, such as residents, they working in the red zone with a huge numbers of our COVID patients, and so really haven't any time to do research. But at the another side, a lot of research is about COVID-19, about the medical education in pandemic times, were published in peer review academic journals. So even the Lancet. So we used to think that the Lancet is for there is a journal for clinical issues, but even the Lancet, during the pandemic time, published the articles about the features of medical education in such challenging times. So maybe the working in red zone with such patients, maybe the topics of research of our residency should be the relevant diseases. So
thank you for the
what do you
question.
think about this?
Thank you for the question. And our residents can choose a topic for their research project. So, but they choose another topic, not about COVID.
Okay. Okay.
Gulmira, can I ask?
Yes, sure.
So, dear Lada, tell me please, how do you choose applicants for this residence? What, yes, how do you choose? It's their wish, or they have maybe must have some, I don't know, points, maybe rating.
How they choose their topic?
How do you choose? No, not topic, persons to this residence.
So you said that only 9 residents from
yes, we allowed them to form small groups, and unfortunately, group not all residents participate in research. You know, some residents just added to the groups, and but not really participated, not search, not really participating in search information and formulating question and appraise protocols, for example, and so on. So 9 active residents and motivated residents, not only 9 motivated residents participated in the conference and present their work. Other residents just helped some, as we can see it.
Maybe they have no time for scientific research, no? Maybe their program is very difficult.
Yeah, I think, yes, thank you. I think they have no skills to report, to perform, and so on.
Lazat, can I ask you a question? And probably it's utter ignorance from my side. But the term residents, does it mean those are students who are in their final years in the clinical phase of their studies?
Sorry, can you repeat your question?
My question is that I simply don't know where you use the term residence for, and that's my lack of knowledge. And my question is, residents, if I understand it well, are students who are in the clinical phase, in the last phase of their medical education. Gulmira says yes, so...
yes, this is a senior students.
Senior students.
Yeah.
Yes.
Yeah. Okay.
And they had first year students in our medical university have a discipline evidence-based medicine or management of research. So our residents must have experience with this discipline, and it's no first time when they must perform research or study about ABM and research management. So, but unfortunately, they have weak skills in their area.
I can understand that when you work from a traditional curriculum, that students don't get many practical skills in doing research before they enter their final years. However, there is certainly hope. I've been at your university twice, as you might know, and one time I was involved in the jury in the board to assess student presentations, younger student presentations on research, and there were some very, very good examples of young students' research presented. The unfortunate part of that type of work often is that it's not all students who are involved, but only, let's say, voluntary students as a kind of an extra to their normal program. Well, those students who are involved, they certainly learn about research methods. And in my personal view, this research training, well, of course, should be part of any medical curriculum. Even if as you rightfully, there are blocks for that. Like in the beginning of your talk, you rightfully said that there are no credits for research education, which is a pity and which needs some pushing from the people who think that is necessary. But even if there are no credits, you may discuss, and it's difficult, I know, you may discuss with your colleagues that you can teach a subject also research-led or research, the four possibilities of Healy, and even when it's not explicitly honored with study points, with credits, it can be part of the educational program. But it needs a mentality shift of some of the old teachers. That's not only true in October, that's also true, I guess, in Birmingham, and certainly true at Leiden University as well, that there's always a kind of a struggle about what a good medical education is, and about and of course we do have to keep and adhere to a good and proven traditions, but we also have to be brave and try new things.
Yeah, I absolutely agree with you. Yes.
So don't give up.
Yes.
Thank you.
Yes, if we said about the competence-based learning and about the senior courses and final learning outcomes, of course, we should include the research skills as obligatory, as a mandatory skills in our competence-based curriculum. So, and trying to reach this competence for all senior students. So, and thank you.
May I add one single matter? I fully agree with you that it should be part of the curriculum. An important competence. For me, one important thing is about research education is research education, when it's done well, it's professional fun.
Yeah.
Students, when students like it, students can expose their
enjoy
skills. They're becoming professionals, So that's, if that were the only reason to do research education, you should even do it. It's professional fun. It adds to the motivation of people, and it makes them better. It makes them professionals from the heart.
Yes.
Yes.
Yeah.
Thank you very much. I absolutely agree with you. And I think we have a potential to increase active volunteers, research students who who want to do research. As I see now, about 10% of our students and of our residents involved in research.
Yeah, it's a pity point, and I think in our national system of medical education also we used to think that our residency is only clinician. Yes, and all education of our residency built in clinical setting, and but of course this time they met maybe only a few pathologists, yes, including the COVID-19. So, but again, anymore they have a lot of opportunity to do some research. Yes, so thank you, Lizat, for sharing this your experience, and maybe this round table help us to improve to our residency scientific potential. Yes, and it's also depend from the mentors of our residents. Yes, yes. So maybe our international collaboration help us and help our students to do their research work. Okay.
Gulmira, can I?
Yes, Diana, sure.
So we in our country, in Russia, and our Russian participants, I think they consider with me, we have research work very active and good developed research work of students and postgraduate students too, but it was not obligatory. It's only on require. But from last year, according to our federal standard of medical education and general medicine faculty, pediatric faculty, this research work was made as obligatory. But due to COVID this situation, we translated our curricula to new this way only from this year, from September, for new first year students, and they receive this obligatory portion of research work. Now we have no experience of this obligatory research work, and but maybe after 2-3 years we will share with our colleagues from different countries of this new experience. What it is necessary to be obligatory or not, or maybe we will see. But really for this year it will be obligatory. And from third year we have this short course of research work for students in all programs.
Okay.
No problem.
Okay, this is interesting, yes. And also, as dear Professor Henk said, about the hard person then for doing some research, and maybe our students also needs in such brilliant mentors as Henk, as our professor from Birmingham University, who can inspire it and motivate it our students to do their research work with enthusiasm and with passion. Yeah. Okay, such a part of continuous professional development. Okay. So, any comments and recommendations and summary?
May I
yes,
say additional comments? Thank you very much for all participants of the round table. It was very interesting information, and I think two last speakers were very close for each other, it seems, because the Professor Wild from Birmingham University tells us that the beginning of the research experience begins from the first year course students, and then by learning of formulating of research questions, and then step by step the students learn how to do research in medical education, not medical education, medical universities. And unfortunately, in our country, students also involved in research only in volunteer as volunteers. They do it by their in a volunteer direction, not obvious, but as Professor from Birmingham University said, the requirements of CONMEDS when one of the direction of medical education is a scholar, it requires some research experience, and it is very helpful to learn our students to be involved in research. And so it is very main part of the education of our residents to be involved in research, and as we told about the triangle, science, education, and clinics, science, research, education, and clinics, it is important part of medical education, and especially of residency, in residency. Thank you.
Thank you, Gaziza, for such great feedback. I think our speakers need in such feedback. And anything else? Anybody else can add some?
I would like to thank
remarks. Yes, please.
Participating. And Gulmira, you did a wonderful job as the moderator of our session, and I'm sure we will keep in touch. And for the rest of the weekend, I have lots of things to think of. And fortunately, it's now 11 o'clock in the Netherlands, so my weekend is longer than yours. Some of us are, let's say, already a bit more advanced in this weekend. So thank you very much for this session, and thank you very much for your very capable mentoring the session, Gulmira.
Oh, thank you. And also I would like to say thank you for the supportive atmosphere and warm environment of our round table, and for your active participation and support. So despite my poor English and some nervousness, and despite the fact that we didn't fit into the time, and I think that our discussion was productive and useful for physical operations. Thank you very much for all our speakers, and a lot of good ideas. Thank you very much. So I don't see any questions or remarks, and thanks from Dania for great presentation. Thanks, Dania, for your feedback, and I think like as an example of our dear Henk, we can write our emails in the chat, and also
I'll put my WhatsApp number as well, if you like.
Okay.
So.
Mm-hmm. Me too. Okay. So thank you very much for all participants from so different universities and countries. Thank you.
Thank you for great roundtable. Have a nice day. Goodbye.
Thank you very much.
Bye.
Thank you.
Bye-bye.
Goodbye.
Bye-bye.
Bye.